Hi, my name's Dr. Marcus Spry. I'm a private dentist in a practice in Maidstone in Kent, Fresh Dental Care, in the United Kingdom. And today what I'd like to do is to talk about dental consent. And although it might seem quite a dry topic, I think it's very important because when you go to the dentist, you have a problem, or maybe you're just going for your regular checkup, and the dentist will explain what they see in response to your checkup or in response to your problem, and then they'll go through the various options. And this is vital because you have to make up your mind what is right. You'd expect the dentist to kind of give you good advice, but sometimes there's a choice, and the choice may affect the cost of the treatment, and the choice may affect whether the tooth is saved or not, and the choice may affect how the tooth looks. So it's important that you make the right choice for you. So the dentist will go through the various options, and believe it or not, the first option is doing nothing. Because that's always your right as a patient, as an individual, as a member of society, to do nothing. But the consequences of that should be explained. So pretty logically, if you're having toothache and you do nothing, you'll keep having toothache. If you have a cavity and you do nothing, then probably you'll get toothache. But nevertheless, it's your choice. And all of this is being done verbally. There wouldn't be anything to sign, or there wouldn't be anything written at this stage. It's entirely okay to just talk about these things. So the next thing the dentist would say is, there's this possible treatment, and there's this possible treatment, and there's this possible treatment. And these three treatment options have advantages and disadvantages, and costs and time commitments and outcomes. And then you'd be in a much, much better position to understand what you should do. And you might say to the dentist, well, what would you do if you were me? And that would be a good question. At the end of the day, the dentist isn't you, and you have to make up your own mind. But I don't mind when patients ask me that. I'll tell them honestly. And it wouldn't necessarily be the most expensive option. Okay, so once you've decided on that, on certain circumstances, you would then need to sign a written consent form. And there is, in British law and UK law, there are two situations where you absolutely have to do that. That is if you're having a sedation, which is where you're given some drugs to make you a bit sleepy, or if you're actually having a general anaesthetic in hospital, you have to, by law, have a signed consent form. But because we want to be doing the right thing and demonstrating that we're doing the right thing, we might also ask you to sign a consent form if you're having something a bit more major done, for instance, a dental implant, or if you're going to go into some more major cosmetic work, or if you're going to have some adult orthodontics done, or if you're perhaps having some facial aesthetics and Botox or dermal fillers done. I think it would be perfectly reasonable for the dentist to present you with a consent form. What doesn't work is to just have that consent form and you sign it. That is not consent. That's just a signature on a piece of paper. So the dentist has to go through the consent form with you, or a nurse or a receptionist or a treatment coordinator needs to go through that consent form with you. And one of the key things that they would ask you is whether you had any questions. And please don't ever feel foolish or inhibited to ask questions, because that is your time to ask the questions. When you sign the consent form, you still have the opportunity to ask questions. I'll come on to that in a moment. But obviously it's much better to ask the questions so that you can make the right choice for you. So, is this a one-way street? You sign the consent form, you've got to have the treatment. Obviously not. The consent is ongoing, and at any point you can withdraw that consent, and the dentist absolutely has to take you that. So if you were to raise your hand in treatment and say, I don't want to go any further, that is absolutely your choice, and the dentist doesn't have a right to insist on you continuing the treatment. The dentist would be reasonable in explaining the consequences of not completing the treatment, but it's absolutely your choice. So I just wanted to go through that so everyone's super clear about how we are, because this is something that's going to be a lot more prevalent. Each time you go to the dentist, you'll notice there's a bit more of this consent process being done, a few more signatures here and there, and I want you to be super confident, because I want patients to come to the dentist, and the reason I want patients to come to the dentist is that they have a wonderful, confident smile that they keep for life. And now, if you like this video, please like, share and subscribe. And if you particularly like it, hit on the little bell symbol, and that will alert you that there's another video coming along. So stay safe and be happy. I'll speak to you next time. Bye-bye.